Good evening, everyone. I will be presenting a case of cortical visual impairment. CVI has been defined as a bilateral visual impairment in the presence of a normal ocular examination, reduced visual acuity or subnormal visual performance, and evidence of damage to the posterior visual pathways. Visual acuity, contrast sensitivity, color perception, and visual fields may all be affected to varying degrees. Causes include premature birth, perinatal insults, hypoxia, ischemia being most common, CNS infections, hydrocephalus, neonatal seizures, and hypoglycemia. Most common systemic associations are neurological conditions, hydrocephalus being a major cause, and as children with CVI usually have multiple concurrent disabilities, multidisciplinary approach is required for early identification and treatment initiation. The patient, 1.5 years old, 1.5 months old, in NICU graduate, presented with a history of neonatal sepsis and hydrocephalus to the ophthalmology OPD for evaluation. And parents gave a positive history of eye contact with mother, but absent social smile. It was a full-term emergency LSCS in view of fetal distress. The child had meconium stained liquor, cried soon after birth, but developed respiratory distress and was admitted in NICU and was on ventilation. There's history of neonatal sepsis, neonatal jaundice, and 2 episodes of hypoglycemia as well. So on examination, the child was not fixing and following point source, was responding well to sound, preferring right gaze. No evidence of nystagmus was noted, and on dilated fundus examination, fundus findings were normal, and the cycloplegic refraction showed a +6 diopters hypermetropia. Child was advised to vision stimulation activities and asked to follow up. Investigations which were done on NICU admissions were CT brain, which showed an intraparenchymal hemorrhage and which was extending into the intraventricular region. And also MRI brain showed an infarct of the left corona radiata, that is periventricular leukomalacia. Neurosonogram also confirmed the findings. Second visit was at 3.5 months. The patient was not compliant. The parents were not very compliant with the vision stimulation activities. Visual acuity was still wandering fixation. Blink reflex to bright torchlight was there, but there was no menace. No fixing even in darkroom illumination, and a diagnosis of cortical visual impairment was made. The child was lost to follow-up till 9 months of age when he followed up, and there was a functional visual assessment done. Visual alertness still was not fixing following objects. There was a delayed response in dim illumination and was fixating only to well-lit bright objects up to a 5 centimeter area, and there was no face regard. Visual sphere was only 10 centimeters, that too in dim illumination, and the visual fields were delayed, and color preference was there, which was yellow. Developmental milestones showed delay in all the modalities: gross motor, fine motor, communication, and socio-personal. Significant history was he had a history of hydrocephalus, but there was no surgical intervention carried out because there was no signs of any raised intracranial pressure. Only the monitoring of head circumference was done. Father was in complete denial of the disease and was not ready to follow up regularly. And mother was overburdened, and she was not very regularly following up with the vision stimulation exercises. A CVA resolution charting was done, and the child was found to have a final diagnosis of cortical visual impairment, phase 2, range 1 to 2, which is a very primitive stage of development, and he was way behind his peers of the same age. Vision stimulation exercises that were given were light pad activities, play mat activities with contrast borders and with different textures. Increased contrast on caregiver's face was introduced by throwing light or using bindis for women or a bright hat for males. And parents were counseled again, and integrated activities with tactile and auditory stimulation were carried out. Speech therapy was carried out, and physiotherapy was started, as the child was also not able to sit. Then the child was further evaluated, classified according to the International Classification of Functioning and Disability and Health from WHO, and various strengths and weaknesses were noted, and the weaknesses were worked upon. On follow-up, parents were still inconsistent, and gradual improvement was there on follow-up visits, but still the child needs a lot improvement in his skills. There is a limited literature available on research for CVI, but mostly in most of the places it's followed like there's no specific treatment given for CVI, and doctors usually wait for CNS maturation, and they say that it will improve as the child grows older. But literature has shown that there is significant improvement if early vision therapy is started in these children. Role of pediatrician also cannot be neglected in sending the patient to a pediatric ophthalmologist as early as possible. So prompt ophthalmological evaluation can help in diagnosing other neurological conditions associated with CVI. High suspicion should be kept in NICU graduate. Prognosis also depends on the site and age of insult. There are poorer outcomes noted in children with insult to corona radiata, especially seen as periventricular leukomalacia on neuroimaging. Early initiation of multidisciplinary rehabilitation has definite role in visual and overall outcome. Future research in VEP, functional MRI, and diffusion tensor imaging to study cortical activation patterns will be of great help. Thank you.
A typical case of CVI does not usually show any CNS abnormality. In the absence of demonstrable CNS abnormality, the child is still not able to see. That is what is described as cerebral cortical visual impairment. Everything else is normal. There is no abnormality of the brain. But here you have shown some abnormality of the brain. So the diagnosis of cortical visual impairment itself is doubtful. Did you get my point?
Yes, sir.
So it is secondary to a problem in the brain. So you cannot call it as cortical visual impairment or cortical visual deficiency when you have demonstrated a change in the brain. You got it?
Yes, sir.